Let's proceed to section 2 of your module with serial key of Westeros 1145. Number 21. During history taking of a client admitted with newly diagnosed Hodgkin's disease, which of the following would the nurse expect the client to report? A. Weight gain, B. Night sweats, C. Severe lymph node pain, and D. Headache with minor visual changes. So the client is newly diagnosed, which gives you an idea that the client is on the early stage of the disease. So let's now eliminate C and D because these two are considered to be late sign of this disorder. Now between A and B, the answer here is Boston. Why? Because clients should have or should report weight loss and not weight gain. So eliminate A, B is the answer. Next, a client who has confusion as a result of bed rest and prolonged length of hospital stay received a prescription for progressive ambulation as tolerated, which is the best nursing intervention to use to implement the prescription. So in this situation, confusion is caused by bed rest and prolonged length of hospital stay. Since this is the cause, and if you want to, um, and there was an order to ambulate the client. The question here is, which is the best nursing intervention used to implement the prescription? So let's eliminate B, because this is not ambulation, right? So there are only three ambulations, A, B, and C. And going back to the situation, you might ask yourself, what is the relationship of prolonged length of hospital stay to confusion? The answer here is, remember that in the hospital, if you have a prolonged hospital stay, there is what? Decreased stimulation, or we call this your decreased sensory stimulation. The client is not being stimulated as often as when he is not in the hospital. So if this is the case, client is prone to develop confusion. So take note of that. Since if you're deprived of sensory stimulation, you can develop confusion. So which knowing this, we can now therefore find the right answer. That is not A, because ambulating in the bathroom will not provide enough stimulation. And let's eliminate B because ambulating within the room will also not provide stimulation. The best answer here is letter C. Next, number 23. Nurses caring for an older client who has been placed on box extension traction after hip fracture. During the assessment of the client, the nurse notes that the client is disoriented. What is the appropriate nursing intervention? Now, to find the right answer, let us try to discuss first the assessment, which is disorientation. Now, the client is disoriented. Why? Why do you think is the client disoriented? Now, remember that, like I said, when there is decreased sensory stimulation, the client may develop confusion or disorientation. Now, you remember that your client is older client with hip fracture, so we know that the client is immobilized, confined to the bed. Okay, so if you're confined to the bed, the client is not ambulating around. Client is prone to decreased stimulation, and actually, he is not at risk anymore because he is already manifesting disorientation. Now, the question is, what is the appropriate nursing intervention? Applying restraint will not cure or manage the disorientation. Ask the family to stay with the client is not realistic. And ask the laboratory to perform lab study. This is only done by the doctor. Therefore, the best answer here is Dallas. You need to reorient your client because the issue here is disorientation. Next, an 18-year-old client is discharged from the hospital after surgery with instruction to use a cane for the next 6 months. What is the best question for the nurse to use to assess feeling about the use of cane? The answer here is letter A. What do you think about ambulating with a cane? Okay. Now, before I'll tell you why. First, let's eliminate B because This is a close-ended question. This is answerable by yes or no. And you cannot assess the feeling by just asking question answerable by yes or no. Letter C is also a closed-ended question. So between A and D, the answer is letter A because letter D, let's eliminate because this is not about feelings. This is not about feelings. This is about obstacles. So the answer here is letter A. Next, 25. Nurses care for a client admitted to the surgical nursing unit following right modified radical mastectomy. The nurse include which of the following in the nursing plan of care for this client. So history of your client is right modified radical mastectomy. And the question is which of the following will you include in the care? First, eliminate A and B because this is contraindicated. Why? Because this can cause what you call your lymphedema. So if a client undergoes modified radical mastectomy, the affected side should not be used as for BP taking and for brain puncture because the client will develop or may develop lymphedema. So between C and D, C, position the client supine with right arm, eliminate C because client should be positioned on a semi-Fowler's position. It should be semi-Fowler's. So the best answer is balance. Check the right posterior axilla when assessing the surgical dressing. Why? Because the posterior axilla is where the blood will accumulate if there is presence of bleeding. If there's a presence of bleeding, like I will repeat, the most probable area where you can find it is the posterior axilla because by virtue of gravity, the blood will accumulate in this area. Next, 26. Nurses care for a client with multiple myeloma who is receiving intravenous hydration at 100 ml per hour, which finding indicates a positive response to the treatment plan. Client who has a multiple myeloma is at risk. This is at risk for renal damage. This is the reason why hydration is being implemented, okay, to prevent renal damage. I repeat, hydration will prevent renal damage. And the best way to assess renal damage is the amount of the amount of creatinine. Therefore, best answer here is letter A. Because the normal value for your creatinine is between 1 I'm sorry, 0.6 to 1.3 milligram per dl. So the fact that this is normal, it means renal is okay or healthy, which means hydration is so far effective. Therefore, the answer is letter A. Now, you might be asking, why multiple myeloma will develop renal damage? In multiple myeloma, remember that client have increased calcium and uric acid, and this substance can cause damage to the kidney. Next, number 27. The community health nurse provides an educational session regarding the risk factors for cervical cancer to women in the local community. Nurse determined that further teaching is needed if a woman attending the session identify which of the following as a risk factor for this type of cancer. What's being asked here is a need for further education or further teaching. So we're looking for a negative statement. Now, all of these are risk factor of type of cervical cancer except Boston. So this is the answer. It should be what? Multiple sex partners. A, C, and D are always factors. It does not need further teaching. Okay, next. Which of the following psychosocial factors obtained during the assessment of an older client places the client at risk for abuse? So we're looking for something that places a client at risk for abuse, and it should be psychosocial. A. Client resides in an apartment in low-income neighborhood. Eliminate because this is not psychosocial. It's probably economical. B. Client shows several signs and symptoms of clinical depression. C. Client is completely dependent on a family member for both food and medicine. Or D. Client has been diagnosed with and is receiving treatment for several chronic illnesses. Eliminate because this is not psychosocial. This is physiologic. Okay, that's physiologic. So between B and C, the answer here is letter C. Why? Because according to your book, um, a situation or condition that we call caregiver strain or caregiver burden process or increases the risk of abuse because the person caring for the client may feel frustrated or may feel or may have some resentment on the client. So remember that caregivers are affected too when they are in the situation wherein they are in charge of caring for their loved ones. Okay, so in this situation, abuse may arise. Letter C is the answer. Next, 29. Nurses care for client with grade 2 mild cerebral aneurysm rupture. Client becomes restless and anxious before visiting hours. The nurse determined that the client's behavior is likely related to first, let's eliminate spiritual distress and disabled family coping because there's no data to support that. Okay. Now, going back to the situation, the client, um, take note, the client becomes restless during visiting hours. So, by this, you can have a clue what's the right answer. Answer here is Boston, disturbed body image. Now, you might be asking, why is there disturbed body image? Because remember that in a grade 2 um, mild aneurysm, client is aware or conscious. There is no loss of consciousness here because the aneurysm rupture is just mild. The client can have nuchal rigidity. So the client have nuchal rigidity. So imagine the picture of a client who has nuchal rigidity and some um, neurologic deficit depending on the site of the rupture. So if a client having a neurologic deficit with nuchal rigidity and is aware of this, that the client is aware that she has this situation, client will develop disturbed body image. And disturbed body image will start to manifest if in anticipation of someone will see or observe him or her, which going to happen during visiting hours. Therefore, the best answer is Boston. Next, number 30. The nurse develop a plan of care to facilitate effective communication for a client will require walker to ambulation. Which should the nurse include in the plan of care? Your the issue in this situation or question is you want to develop effective communication. So which among the four will provide effective communication? Eliminate A. Directing client's discussion will not be effective. Okay. Next, eliminate C because of the word only. Remember, absolute words are wrong all the time. So between B and D, the best answer here is Boston because first let's eliminate D because this is not related to effective communication. Letter B, how on the other hand, is focusing on the client's message. It actually means active listening. Okay? Listening or focusing on the client's message may mean active listening. And this is an effective communication skills. B is the answer. Next, 31. Nurse is caring for a client with heart failure who has magnesium level of 1.4 milligram per dl. Nurse should, so for us to get the right answer, remember that the normal value for your magnesium is between 1.8 to 3.0 milligram per dl. A value of 1.4 is low. Client has what? Hypomagnesemia. The client has hypomagnesemia. A. Monitor the clients for dysrhythmia. B. Encourage the client the intake of antacids. Eliminate because this is under doctor's order. C. Teach the client to avoid food high in magnesium. No, the client should not avoid because the client is hypomagnesiemic. D. Provide diet ground beef, eggs, and chicken. Eliminate because these food are low in magnesium. Best answer? A. Remember that magnesium or electrolytes can have or can affect your heart contraction. It can lead to what? Ventricular dysrhythmia. So you need to monitor the heart rhythm. Next, nurse care for a client who has been transferred to the surgical unit after a pelvic accentuation. During the postoperative period, the client complains of pain in the calf area. What action should the nurse take? So the client is complaining of calf pain, which may indicate a possible DVT, right? So lightly massaging will be contraindicated. Administer morphine is not related to this is not related to possible DVT. Remember, this is the issue here. So between A and C, the answer is letter C because this will provide additional sign and symptom or assessment to confirm if the client has DVT. Next, a physician prescribed acetaminophen Tylenol liquid for 250 mg every 4 hours per and for pain. Medication labels 160 mg per 5 ml. Nurse prepare how many ml to administer one dose. So remember that our formula is the desired over stock times the quantity. In this case, our desired is 450 milligrams divided by 160 milligram times 5 ml. You will compute this, you will get 14 ml. Therefore, the answer is 14 ml. Next, number 34. A nurse is preparing a plan of care for a child with leukemia who is scheduled to receive chemotherapy. Which intervention should the nurse include in the plan of care? Okay. Is it A, monitor rectal temperature? Now, to find the right answer, let's go back to this equation. The client has leukemia, and a client who has leukemia has low platelet and has immature WBC. And to cut it short, client is prone to what? Bleeding, and the client is prone to infection. So eliminate A. Remember that rectal is contraindicated in a patient who is prone to bleeding. Okay, so eliminate A. C. Encourage the client to consume fresh fruit. Eliminate because this is contraindicated on a client who is prone to infection. So between B and D, B. Provide meticulous mouth care. That's true. Incorrect. Several times. And use O. Alcohol-based mouthwash is wrong. Remember, mouthwash that is alcohol-based will cause what? Dry. It will cause dryness. Therefore, the best answer here is Boston. Monitor mouth and anus for breakdown. And breakdown can lead to what? Episodes of bleeding. And client is prone to bleeding, remember? So B is the answer. So you need to monitor so that you can prevent it earlier. Next, number 35. A nurse's care for an infant after pyloromyotomy performed to treat hypertrophic pyloric stenosis. The nurse places the infant in which position after surgery? Now, the client has pyloric or history of pyloric stenosis, and the client has just had a surgery. So let's eliminate A and B because remember that this client is still prone to what? This client is still prone to vomiting from pyloric stenosis. So flat will increase episodes of vomiting. And supine is same with flat. So eliminate. The answer here is letter C. You need to elevate the head of the bed. Okay. Next. A mother of a child with mumps calls the healthcare clinic to tell the nurse that the child has been lethargic and vomiting. Next, the nurse tells the mother to which among the following? Answer here is Boston. Bring the child to the clinic. Why? Because mumps can lead to a complication called we call this your septic meningitis. And septic meningitis is manifested by lethargic or lethargy, vomiting, and nuchal rigidity. So, presence of this may indicate developing septic meningitis. You need to bring the child to the hospital for evaluation. Next, a nurse is reviewing a physician's prescription for a child who was admitted to the hospital with vaso-occlusive pain from sickle cell anemia. Which of the following prescription would you question? Answer, Dallas. Obviously, remember that this is contraindicated to children. Why? Because this can cause, or this drug can cause episodes of seizure. This is the answer. Next. The client, or a nurse's care for a client who is infant and has a laryngomalacia or congenital laryngeal stridor. Which position would the nurse place the infant in to decrease the incidence of stridor? So first, let's eliminate supine because supine is not good for breathing. Between A and D, the best answer here is Dallas. Okay, based on your book, prone with the neck hyperextended will facilitate breathing to this patient. It will facilitate breathing to these patients. Now, for you to be able to understand this more, you need to review your concept on laryngomalacia. Next, a nurse is planning care for an infant with diagnosis of encephalocele located in the occipital area. Which item would the nurse use to assist with positioning the child to avoid pressure on the encephalocele, I should say. So, issue here is, what would you do to avoid pressure on the encephalocele? Now, remember that this client, for example, this is the head of the client. There is a protruding part of your central nervous system at the back of your client. So, to avoid pressure here, you need to use your, what you call your letter D, your foam half donut. If you have seen some pillows who look like this, yeah, this is an example of a foam half donut. You put this here so that once it is here, okay, This will provide or prevent pressure on that area. Next, client is admitted to the hospital with fractured hip and experiencing periods of confusion. So, client is experiencing confusion. Nurse formulate the diagnosis of disturbed thought process and identify which psychosocial outcome is a priority. Answer here is Dallas. Why? Because for you to be able to um, improve the sleep, reduce fear, or meet self-care, the client should be able to concentrate. The client should have the ability to concentrate and make decisions. Now, if you remove this, therefore the client cannot participate to whatever intervention you will perform. So therefore the priority here is Dallas. If Dallas is has been taken care of, there you can now take care of A, B, and C. Okay? So that ends section 2 of your module. I'm looking forward to be discussing your section 3, and I hope you got high on your exam. Thank you.